It is now 10 a.m. in the capital, Nairobi. Good morning and many thanks for joining us here on KTN News Center. My name is Michelle Ngele. In this hour, we shall be keeping you up to date with the latest going on around you, including the burial ceremony of the late Interior Cabinet Secretary, former Interior Cabinet Secretary Joseph Nkaissery. Also, in this hour, as we do every Saturday, we shall be delving into health, and we have our medical correspondent, Dr. Mombasa Road, who will be joining us in studio to speak about the allegations of a cholera outbreak in the country. That and so much more right here on KTN News Center. Welcome to the program. Our top story this morning: the fallen Interior Cabinet Secretary Joseph Nkaissery is set to be laid to rest today at his Kajiado home. Nkaissery passed away on the morning of Saturday last week after collapsing in his house. We shall bring you live proceedings of the burial ceremony, which will take place at his Bisil home in Kajiado County. That live feed coming to you in just a moment. Now, Transport and Infrastructure Cabinet Secretary Dr. James Macharia has claimed the attack on his Public Works PS Mariam El Mawi in Lamu on Thursday was politically motivated. Dr. Macharia says the PS underwent an operation yesterday and she is now in a stable condition.
We are very saddened by the recent attacks of government officers. Only recently, my own principal secretary of Public Works, Mariam, was attacked. I'm glad to report that she is safe. I saw her this morning at Aga Khan Hospital after coming from surgery, together with the Chief of Staff and Head of Public Service. She is out of danger, but we must condemn in the strongest terms possible. This is a civil servant, a public servant, who was trying to bring development to an area which is hitherto underdeveloped. And we cannot tolerate that kind of conduct, whoever is bringing up those issues. We have to condemn those actions in the strongest terms possible.
Well, let's focus on health now. The Jacaranda Hotels management has stated that none of their hotels provided any form of catering services for the trade expo at the KICC, where delegates are said to have fallen sick after consuming the food. The Jacaranda Hotels also said none of their staff had been treated for cholera, as had been claimed by some reports appearing on the internet. Cabinet Secretaries Henry Rotich and Aidan Mohammed are reported to have been treated with symptoms of food poisoning after attending the trade fair at KICC. Here now is that report from the Friday incident.
Unconfirmed reports indicate that the two ministers, Henry Rotich for the Finance Ministry and his industrialization counterpart, Aidan Mohammed, were treated in what is purported to be food poisoning and possibly cholera cases. It is alleged that the two are among dozens of senior government officials admitted in various hospitals in the city after attending a trade forum at KICC. Staff from a city hotel were also reportedly affected after reports emerged that they were also hospitalized, with some placed in the isolation room receiving treatment for cholera-related symptoms. It is, however, confirmed that 6 among the trade expo attendants reported at the Aga Khan Hospital, among which 2 were tested positive to cholera. This comes barely 3 weeks after doctors attending a workshop in Western Hotel were hospitalized following a cholera outbreak. The Health Ministry has directed that the reports should be treated as mere speculation at the moment, as we wait for further information concerning the matter.
Well, that conversation forms the basis of our discussion here in the studio with our medical correspondent, Dr. Mombasa Road. Many thanks for joining us, Dr. Road.
Good morning, Michelle.
So a lot has been said, a lot of speculation, first of all, about this possible cholera outbreak in the country. But the first question is, cholera is usually associated with poverty. Why are we seeing this now recurring, at the top echelons and high-profile events like this?
I think that's the big question amongst very many people, that we may not really have a definite answer, just apart from speculating. One is that if you notice, since May, we have been reporting incidences of cholera. In May, we reported one during a wedding in Karen. In June, we reported the Western incident, and now we are reporting at KICC. So the question is, does that point to a localized problem, or does it point to a more global problem affecting the whole of Nairobi?
Right.
Remember that cholera is spread from contaminated water and food. So the question begs, how safe is the water that we are using in Nairobi? Is that the source of the problem?
Well, because I understand even one of the delegates at KICC during the trade fair reports that he only took water in the entire during the entire time, but he has also been treated with cholera-like symptoms.
Yes. See, no, that's the big question, because where are we getting our water from? Is it safe? Is it contaminated somewhere along the pipeline? Or are we getting water from the clean water trucks that we don't really know where this water is coming from?
Right.
Secondly is the food handlers from any facility, any hotel, any small restaurant, any cafe, they're supposed to undergo regular checks to make sure that they don't have any foodborne or waterborne diseases that they can easily transmit when they are preparing and handling food.
Right.
So the question is, how are we doing when it comes to our public health and taking care or following up on the food handlers or the hotels that are providing food? Are their handlers regularly tested? Are their handlers regularly checked? How safe is their water? What is their water sources? Is the facility clean? The circumstances or the situation where they're preparing food, is it clean? So that they can, prepare the food so that they don't, in case of contamination, they don't get such widespread widespread spread of cholera, of a disease, because cholera is not the only foodborne or waterborne disease. We still have dysentery. We still have typhoid. So there's a number of other diseases that really, cholera may just be a sign or a tip of the iceberg. What we need to look into is go deep down and ask ourselves, what is the root cause?
Just taking a look at this, happened at the KICC during the trade fair, but it also happened, the debacle at Western Hotel. There was wedding at Karen, which also had the same issue. But we're still talking of the cabinet secretaries being treated for food poisoning-like symptoms. So can we comfortably say that there's a cholera outbreak in the country? Looking at Twitter, Dr. Njoki here says, when cabinet secretaries got cholera is when it becomes a national conversation. But when healthy people, have been, when Kenyans have been shouting this for many months, it has not been addressed. So is it a cholera outbreak or is it food poisoning?
Well, Michelle, for one to define a cholera outbreak, you need one confirmed case in an area that is not known to be endemic for cholera. Now, how do you confirm cholera? We do what we call a culture test, where we basically take the sample from the patient and grow it. And if one of the samples grows cholera, then it's enough to actually declare an outbreak. So we should have declared a cholera outbreak from May and actually taken steps to find out where the cause is. Now, as Dr. Njoki has rightly put it, it's like now poverty is known to be a disease of the poor, but now when it comes to the high-end unexpected places, it becomes an issue. But talking to the doctors who deal with patients each and every day, they have been reporting cholera cases every other time. That, because cholera is a notifiable disease. Once they get suspicions and confirm, they notify the public health officials who are supposed to do their part in tracing the source of the disease. So for me, or from where myself and other doctors are, there's somebody who's sleeping on the job, who's not actually going to look
at what's happening. Because I'm also looking at another tweet here from the KMPDU Secretary General Omar Oluga, and he says cholera outbreak is real, finding its way right into the cabinet. I hope that they could now convene and summon the Ministry of Health to take urgent action. So in terms of procedure then, who should have declared this an outbreak?
Remember, health is devolved. So both the Nairobi County government, working with the Ministry of Health, the National Ministry of Health, should have sat down and convened and told us, we have a cholera outbreak. When they came out and said they have confirmed 6 cases from the Weston incident to have cholera, that's when they should have declared a cholera outbreak and taken proper measures. Remember that time they told us they put together a task force and in 14 days they were to give a report. We are still waiting for the report.
Right.
So this disease does not really give time for people to dilly-dally and, pass the buck on to somebody else. Somebody should have taken action and told us. And if you note from the current incident, the government told us that, the disease was brought in from Vihiga because they had delegates coming in from Vihiga to the wedding. When it happened at Western, what did they tell us? These people ate outside or they had outside caterers. At KICC, they are telling us the same, that,
we've seen Jacaranda Hotel come out and say they did not provide any of the catering services as well.
Yes. And another food provider was, outside caterer, was actually, has been mentioned as one of the ones who are providing services at the KICC. So we look, what we get from here is that is somebody shifting blame to somebody else, trying to blame somebody else for this disease instead of looking at where the root cause is. I remember this, as the Kenya Medical Association, when we had the Western incident, actually said that it's an indication that there's a failure of primary health care, because with cholera, it's a foodborne disease. It's passed from contamination of water and food. So it's a failure of basic primary care provision, basic failure of clean water provision and sanitation.
So this is an interagency approach
it is,
to solving this problem.
Definitely.
But even as the agencies try to solve the problem, the bigger question would be prevention measures for Nairobians, because if it is something that can affect water, which we all consume, mostly comes from the same source, then we need preventary measures. What can residents of Nairobi do now?
Well, people should boil their water. That's one thing. Any fruits and vegetables or any food should be thoroughly cleaned. People should wash their hands every time they go to what they call the small office or to the laboratory. They should wash their hands, yes. Which I think even children know, that every time you go to that office, you have to wash your hands.
Right.
And then two, this now comes to the government. They need to tell us where the source of the disease is coming from, so that people can avoid that area. Where the incidents were reported, they should be quarantined until they can be certified clean and safe. Now, those who have been affected or who are sick should actually seek medical care as a matter of urgency, because they need to be rehydrated. Because what kills many people with cholera is dehydration. They lose their body fluids quite fast, and so they need to seek medical care. And when they go to hospital, they'll probably be quarantined, because so that they don't further spread the disease. So it's a whole chain, and as you've said, it's multi-agency. You and I can only do our bit, but also the government needs to do its bit. They need to assure us that the water that we are consuming in Nairobi is safe. And it's not only in Nairobi. Remember, people move around. So probably very soon we'll hear
spread.
Yes, it is quite high.
Right.
So something needs to be done, and it should be a matter of urgency. And it's sad that we are now actually looking at it as a matter of urgency, because now we are reporting cases from what is the high-end areas of Kenya, or what is perceived to be high-end, or the unlikely
And of course,
to have cholera.
finally, like you mentioned, anybody who goes to hospital and is confirmed to have these symptoms may be quarantined, just so they don't spread this, which is something that scares a lot of people from getting medical access in the first place. But how imperative is it that anybody who has these symptoms seeks medical care, especially those who are living with people?
You see, cholera does not give much time for you to think about, should I or should I not seek medical care. If you have your person who is who you suspect to have cholera, it does not give you time to wonder whether to go to hospital or not. And any health facility, even the most basic, know how to handle cholera cases. So it's very important that even if it's suspicion, somebody is much safer going to hospital and they are told, no, it was just some other kind of food poisoning that is not cholera, other than staying at home and waiting to see if it goes on its own, because that one may have a detrimental effect.
And then there's a question of, is it cholera or is it not? So in terms of the symptoms one should be looking out for, what are the symptoms?
Okay, cholera gives what you call painless, watery diarrhea. So it just be somebody will have diarrhea, there'll be a bit of vomiting or nausea, but it really happens very fast. I think that's the most outstanding sign for cholera, that or symptom for cholera, that the person should know. So once somebody has acute diarrhea and it's painless, they should go to hospital immediately.
All right, so as it is, of course, you don't speak on behalf of the Ministry of Health, but are we expecting this to be declared as a cholera outbreak, a national outbreak, in any time soon?
Most definitely. We do expect that the Ministry of Health and the county government of Nairobi Department of Health should do that. And at 11 a.m. today, we're expecting that the county executive committee member for health, the county government of Nairobi City, would hold a press conference and tell Nairobians exactly what is happening. Also in this press conference, we're expecting to get a report of the Weston incident and even the current incident, you know, because we expect that it's been 2 months at least for the current incident, almost a month with the Weston incident. We expect that proper investigations would have been carried out to trace the source of those infections. You could find that it loops back to what we are having currently. So we expect that, one, they should tell us what exactly the situation is, and two, what are the reports from the 2 previous incidents, and 3, what are they doing about this current incident reported from the KICC.
All right, thank you so much. That is our Dr. Mercy Koriro, a medical correspondent here at KTN News, and she'll be keeping an eye on that developing health story in the country. But let's move away from matters health and move to Kajiado County, where the fallen Interior Cabinet Secretary Joseph Nkaiseri is set to be laid to rest today at his Ilbisil home in Kajiado. Nkaiseri passed away on the morning of Saturday last week after collapsing in his house. Let's now head over to Kajiado and give you live pictures of the preparations for that burial ceremony. Joseph Nkaiseri is one of the 4 leaders that the country has lost this month. The burial of these leaders beginning yesterday with President Uhuru Kenyatta attending the burial of the late Senator Gigi Kariuki. President Uhuru Kenyatta is also expected to attend the burial of Joseph Nkaiseri, who is the first cabinet secretary to pass away under the new constitution 2010. So live pictures there coming in from Kajiado. Let's cross over there and